Hi, welcome to Doctors on Doctors by Bangalore Hospitals. I'm Dr. Lahari and I am your host with Dr. Phani Madhuri, who is one of the best obstetricians and gynecologists in Bangalore City and is my personal doctor as well.
I'm so happy to see you, Lahari, this morning, and I'm so looking forward to this beautiful conversation.
Yes, I have been looking forward to this for a very long time. Just because not only is Phani ma'am my own doctor, but also a very, very good friend and a role model of mine as well. So let's get into it.
Very sweet of you. Thank you for that sweet introduction.
So the topic today is more about women's health. Why is it taken a back seat, and who are the people bringing it to the forefront? So I was at a conference recently, and I heard somebody say that women first take care of their siblings, then they take care of their husband, then they take care of their child, and once their child grows up, they take care of their parents again, and then finally they miss that window where they're supposed to be taking care of themselves, and by the time they look towards themselves, disease has struck them.
Oh, absolutely true. What you're saying is 100% on, because I see this day in and day out with all women. Either if they're working or not working, the scenario is more or less the same.
Yeah, I feel like even I just can't find time to come in. We literally, she says like just 5 minutes, and I just can't even make that much time. So do you feel like there should be some sort of a schedule to prevent things from happening for a woman?
Absolutely. I think emphasis is the single most important thing. Like if a person starting from their childhood, nobody is actually taught that you need to segregate a certain amount of time in a day for your own self, for your own mental health, for your own physical health. Nobody has taught us this. And if we try to opine this thought and take out our time from our daily routine, saying that this 1 hour is for my physical exercise, this 1 hour is for my yoga class, it becomes to say that we are over demanding. Probably we are not as focused on our family or professional lives, which is totally wrong. I think we have to let everybody be in this common thought process that segregating certain amount of time for your physical and mental health is a part of your routine no matter what. See, what happened earlier on is people were physically active by the nature of the day. The kind of activities one were doing all throughout the day demanded a certain amount of physical exertion, which is no more the norm today. We are, as soon as you get up in the morning, everything is at fingertips. We have people to help us out with our food, our travel, our work, and our only focus is to kind of, get the work done at home, at office, and make the money, and you're stressed out by that process. And so, of course, with aging, there is a lot of restriction of mobility. There are a lot of health issues that come in. And that is the reason why most of them, in spite of having time, knowledge, and they have the provision to do it, but they can't do it because of the physical limitations. But what happens in your constructive, focused years, like your teenage, like your college days, like your early youth, like your early marriage, these are your most important years, wherein your physical training, your nutrition, your lifestyle, your sleep are paramount importance. This is the prime time that people are losing, and that's why the 60s and 70s are lost. This is my interpretation of what is happening. So if you focus very early on, like I see that changing trend now in the last 10 years, people are again going back to their roots. They want to focus on their home food. They want to make their own food. They want to try to see where is their food coming from, the procuring of the ingredients, everything. People are trying to pay a little more attention, which is such a welcoming change. And this is what I want to prioritize. And I want to tell people that it's all about nutrition and a balanced life. We don't have to race against time or race against people to prove a point. All we need to know is understand your own body, understand your own construction, like, what you need to do for yourself to make you the most productive. If you get an idea, this usually takes a couple of years for each one during each phase, especially the women, because you go through so many hormonal changes at each phase of your life. So once you've understood the simple concept, it's in auto mode. You can just make your practices so easy and life feels easy. Otherwise, I routinely see a lot of women post 45 who are really in a bad shape mentally, physically, hormonally. And we know that the highest suicidal rates in women is between this age group, like 45 to 55.
Oh, really?
They can't cope with the receding hormones, with the excess body weight, comorbidities like your diabetes, hypertension, joint issues. They just feel life is too much of a pain for them to take it on. They're not able to manage at all.
So what comes first? Do you think the hormone issues or the lifestyle issues?
So everything goes hand in hand. I think the hormones are a part of your natural body's evolution. Starting from the age of 10, you see the onset of puberty. Then your puberty has its own changes that will take some time to settle, usually about 8 to 10 years. And then once you enter your reproductive age group, that is when you start becoming sexually active, you come with its own challenges, like, you have to worry about your pelvic infections. You have to think about your contraception, planning your family, the right age to plan your family. And of course, things like fertility issues also may crop up in this age group. So once you're over all this period, nowadays we are seeing a lot of women with decreasing ovarian reserve. This was not seen earlier. We are seeing women early 40s, late 30s who are coming up with very less ovarian reserve, all perimenopausal symptoms. The age of menopause is only declining over the last 100 years.
Yeah.
It was 55 earlier, now it's 50. Now, people are having menopause at 45, 48. Women are born only with a set number of eggs.
Yeah.
We don't produce new eggs on and on as we, grow older in our life.
Yeah.
So the maximum number of oocytes that we have in our body is actually when we are within the womb of our mother.
Okay.
That's about 5 million. And this number deteriorates to about just 1 to 2 million by the time of our own birth. So that's how fast the apoptosis happens, right?
Okay.
So there's a constant degradation of the
Yeah.
cells in the body, and the number reduces to 1 to 2 million at birth.
Yeah.
And then this number is usually stays like that, but it slowly deteriorates further, and it's about 3 to 5 lakhs at the time of the onset of puberty. So you begin your reproductive age group with this number of 3 to 5 lakhs.
Okay.
And then month on month, there is a certain number of oocytes which get recruited, which come into the follicular phase of the cycle. And not all of these are capable of growing into a mature egg.
Yeah.
So out of these hundreds or thousands of eggs that get recruited, just one becomes a dominant follicle and one egg is released in one cycle.
Okay.
That is the reason why humans just normally produce one baby at a time.
Yeah.
Unlike other mammals where there are about 10, 20 children that are born with one delivery, right? So, and this number, as we are aging in that reproductive age group, we normally ovulate around 300, 400 eggs. And by the age of 50, this number is down to by about 1,000.
Okay.
And once you hit this number, technically the number of eggs in the body are exhausted, and that is where your menopause sets in. So this is called decreased reserve, right?
Do you have a less reserve than you start menopause earlier?
Yes. So technically, either you begin with a less reserve or you're exhausting your reserve faster.
Okay.
So these two scenarios, you will have an early onset of menopause. So some people may be born with less number of eggs by birth because of some genetic alterations or because of some traits which are passed down in the family, or it can be rarely some infections like tuberculosis, childhood tuberculosis, or autoimmune diseases, or if they're exposed to some surgery, an ovarian tumor which has been operated where a mass of the ovary has been removed,
Yeah.
or if they've had like infections in the pelvis, or if they've had any viral infections also, like especially mumps or any other diseases which have definitively decrease the blood supply to your genital organs,
Okay.
and that can reduce your ovarian reserve. And there are some women, like that not every woman has an onset of menarche at the same time or onset of menopause at the same time, right? So there are some girls who start menarche early. Like there is a girl who is starting menarche at age 10. There may be another girl who is starting menarche at age 14. Now technically the girl who started menarche at age 10 will have an early menopause.
Okay.
That means she will exhaust the number of follicles early on.
Yeah.
And now again, there are women with shorter cycles. Like there is a woman with a cycle duration of 20 days. and there is a woman with a cycle duration of 40 days.
Okay.
So obviously the woman with a cycle duration of 40 days will have the egg number reserved for a longer time.
Okay.
So she may have menopause a little later than the woman who's having shorter cycles.
And how
So this is how it goes.
Like, how do you know that you have less ovarian reserve?
Well, one thing is, I think you can always opt out for a general health checkup in your early 20s, which includes a basic ultrasound scan
Yeah.
and a simple blood test called AMH, that is your anti-Mullerian hormone. It's a fantastic test to understand what is your egg reserve is at.
Okay.
Right? So an optimum ovarian reserves should be somewhere between 2.5 to 3 nanograms per ml.
Okay.
If it is lower than 1.5, you know that you are on the lower phase. How fast it's going to deteriorate or how early it's going to deteriorate, that is something that nobody knows.
Okay.
But at least we can warn the girl saying that yes, your reserve is probably low. Try to plan your marriage early, try to plan your family early in case you have those things as your priority. Or you can also think of egg freezing.
Yeah.
Yeah, just in case you're not mentally yet prepared for a family, you can always opt for egg freezing,
Yeah.
which has to be done at the right time to get the maximum benefit, right?
Okay. Yeah.
We have women coming in late 30s and 40s for egg freezing, which is technically, not so useful because you're already in the last phase of your ovarian aging. And whatever eggs you get at this time are not as potent as what they are at your younger age group. And thereon, every girl should be educated about self-breast examination. These are simple things that you need to notice in your own breast. You be in a relaxed position with your relaxed arm, and with the palm of your hand, you can just palpate your breast to understand if there are any lumps, any abnormal growths, any puckering on the skin, any discolorations, any abnormal secretions from your breast, any tenderness, any pain, any other abnormalities that you notice in that area, you bring it to the notice of your treating clinician.
And you know, start earlier because you need to get a baseline of what your normal breast is like. That only it makes sense.
Absolutely.
From a surgical standpoint, you've got to start early, do it every month, and every 6 months identify a good breast surgeon. Who's going to, every 6 months you go and you show your breast, and if it's a lady, then even better. Like we have patients who are with us from 20 to as they go on. Every 6 months it's a hi, how are you doing, check breast, do a pelvic ultrasound, and then every 3 years a pap smear. So there is a method to the madness. It's not like,
You just do it with your wish and will.
Wish and
Yes.
will. And it's like every doctor does prescribe different things, but you need to be able to identify the doctors who really believe in prevention more than cure.
Absolutely. That is
Yeah.
the need of the hour now.
Right.
Yeah.
And why do you think prevention is so important now?
Prevention is important because you pick up the disease early on.
Yeah.
It's very simple.
Yeah.
It's good for you, good for me.
Yeah.
It's easy for you, easy for me.
Yeah.
So, all of us are in a good space.
Right.
You pick it up early. There are some simple things that can sort it out completely. And even if there is any surgical options, they will be very, very easy and simple.
Yeah.
You can avoid a lot of unnecessary extra treatments like your radiotherapy, chemotherapy, if at all things are picked up early.
Yeah.
So there's a lot of advantage of preventive healthcare.
Yeah.
To continue with your breast prevention, breast examination, I think post 40, everybody needs to start getting a mammogram done.
Yes.
Very important now because there is a rising trend of cancers all over.
Yeah.
And breast cancer is quickly picking up. It's
Yeah.
all over the place. So I think doing a mammogram after the age of 40 and then keeping a follow-up of that is excellent in terms of prevention of any early onset disease. Yeah.
Recently, I have a lot of patients who come in for breast even at 30s.
Yes.
Just because the incidence of, we call it like sporadic breast cancer, where you don't really know what's the reason for it.
Absolutely.
Could be genetics, could be epigenetics, your environmental factors, or it could just be that, it just happened, is what I tell my patients.
Like I was talking, you were talking about breast benign masses. Yes, we see a lot of young girls with a tendency to have fibroadenosis.
Yeah.
That means they have a denser breast, they have more fibrous tissue in the breast. So they always have this constant feeling of, there is a lumpiness in the breast. It's not soft and even, or it's not like what, the social media depicts the breast to be, right? So there's a lot of confusion in young girls' minds. And this fibroadenosis is also a condition where the breasts are not as supple. So there may be some kind of pain or discomfort, especially exacerbating just before your menses or just around your ovulation. These are very common symptoms. So these are benign conditions. The second benign condition is fibroadenoma, which is again a proper lump. You will be actually scared to see it. You can even see a lump moving around all across your breast. It's a very mobile mass.
A mouse in the
Yeah,
breast.
yes, it's like a mouse in the breast. And these are very, very common in young girls. And we also see a tendency that people who are prone for these kind of fibroadenomas in the breast tend to have fibroids in the uterus. It's a very interesting
really?
finding. Yes.
I don't know.
Yes, they are, I think, sisters of the same family is what I always feel. Because generally people who have a tendency to have fibroadenomas have fibroids in the uterus. You were talking about abnormal masses in the uterus and in the ovary. Yes, a lot of women can have benign masses like fibroids. Fibroids are just again a simple bundling up of the normal muscle tissue of your uterus. The uterus is nothing but a muscle tissue like your arm muscle or your leg muscle. And this muscle sometimes can bundle up, form a little more hardy lump, and that lump is called fibroid, right?
Yeah.
And they're usually benign. And if they're small in size and if they're not causing too much of a distortion of your uterine cavity, that is the main cavity from where you bleed every month, where you put in your baby, where you grow your baby for 9 months. If this area is not disturbed by these fibroids, then they're generally asymptomatic. But if the fibroid becomes bigger, if it's larger than 4 or 5 centimeters, if there are multiple same sized, which is again enlarging your uterus, obviously it will start pressurizing your adjacent organs like your urinary bladder, or it can put pressure on your bowel. The common symptoms is people have, recurrent UTIs. They can have urgency, frequency of urination. They can have chronic constipation, various other bowel and bladder symptoms. Many a times they may not have gynec problems. They may have these issues.
And this is early.
Yeah, they may have it early on. Yes, anytime they can start. These start usually as soon as your reproductive age starts, because they're all estrogen dependent hormonal diseases. So the moment the body starts producing more of estrogen as your cyclical season starts, your certain body types are more sensitive to the hormone estrogen.
Yeah.
These are the ones who are prone for more fibroids. They are prone for endometrial hyperplasias. They're also prone for cancers later on. Okay. This tendency may also be seen in patients with polycystic ovaries.
Yeah.
Again, because PCOS is a hyperestrogenic condition. Now, there is a lot of estrogen hormone in these women, which is why they're oversensitive. And because of this, again, the same kind of problems can happen, right? And coming to the ovary, yes, ovary is a organ which has a lot of cyclical changes throughout the cycle, the first half. There are 4 phases in a menstrual cycle. One is your menstrual phase, then the follicular phase, ovulatory phase, and luteal phase. So each phase of the cycle, the ovaries go through a lot of changes hormonally and structurally also. So the follicle starts growing, and then after your ovulation, either it forms a corpus luteum, or sometimes it can be a cystic follicle, which is not a very healthy follicle, and they remain like that for a couple of months.
Yeah.
So these are called functional cysts or follicular cysts. Now, we are also seeing an increasing trend in a condition called endometriosis. Now, this was not heard of 100 years ago that much, but India now, because of the modernization, probably, the lifestyle changes, the food that we are eating, the processed food, we don't know. It's a pro-inflammatory condition and probably an autoimmune etiology also. And there are a lot of women who are prone for endometriosis.
Yeah, and it's quite ravaging on the body.
Absolutely. Why? Because it behaves almost similar to cancer. This is what I tell my patients. It kind of, is constantly inflaming your tissues, causing fibrosis, breakdown of the cells. Chronic inflammation and fibrosis is an ongoing process. And that's why it eats up all the tissues in and around the organs, and it distorts your anatomy.
Yeah.
And that is the reason for your chronic pain and dyspareunia and dysgeusia, dysmenorrhea. All these symptoms are because of the chronic inflammation that the condition is causing.
So listening to all of this, it's like there's such a huge spectrum of disease in women. that we're able to just say at least 10, 15 of the conditions in like 5 minutes. And this is just the tip of the iceberg. So the purpose of us coming together today is to tell you that you have to have a specialist doctor on your side from the time you hit your 20s, 25th birthday. Just identify your doctors and keep going. There's nothing wrong in your doctors kind of being like your friends. Yeah, nobody's going to tell you like, oh, don't see us like that. We're only your doctors. Ultimately, the whole point of the podcast also is to give you inside information of Bangalore Hospitals doctors. Like, and from the
what's our approach?
Yeah, what's the approach? Like from the management side also, when we pick relationships with doctors, I wouldn't say we hire them. We pick relationships with doctors because ultimately, if I have a friend or if I need something, we end up coming to our own hospital, right? So there's no point in hiring doctors who don't have the same agenda.
Connect.
Yeah. Connect. So our thing is that we don't, say only this much time or whatever. And
no, like I said, 25, but I'm seeing a lot of positive changes nowadays in the last 10 years, especially because of the awareness.
Yeah.
All the mothers are working.
Yeah.
And the moment they have a girl child, they're so proactive in their health, Lahari.
Yeah.
Let me tell you, we have young girls as early as 15 who are coming for a regular gynec health checkup, which is fabulous change. Because we can instill, no matter how much your mother tells you about the right food, right diet, right exercise, the children still listen to when they come to their doctor or their teacher.
Yeah.
That is how it is with the child psychology, and it really works.
Yeah.
Because once the doctor tells the child that, you need to eat this, you need to do this, you need to sleep on this time, it's taken.
Yeah.
But when the same things are advised by the parents, it's not taken so seriously.
Yeah. A lot of times, even if it's awkward for the daughter, he waits outside.
Absolutely.
So men are also picking up nowadays. I guess we can't totally discount them, but definitely that, as you said, the trend is going.
People are getting proactive with preventive health, which is the most positive change that I've seen.
Yeah.
And I'm very impressed because when I began my gynec practice about 25 years ago, there were women who were apprehensive of going to the doctor. They felt that they should not see a doctor till probably, they go for a delivery. That was a taboo because they thought, the periods pain have to be tolerated. There is nothing to, blow this out of proportion or to overthink about it. There is, all this is a part of your normal growing up age.
And it's awkward talking about it.
Yes, people thought they could be overtreated if they see a doctor. There were a lot of apprehensions and taboos around this period issues. But now mothers are very proactive. They bring them on early on for, the HPV vaccinations. They also want a regular checkup, and people understand the value of an ultrasound examination, which is such a value-added test, I tell you, because it's such a simple, easy, non-invasive test, which can give you enormous information about your overall health, mind you. And it can pick up most of your bad diseases very early on. And like I said, treating them early on is always easy in terms of treatment and also the recovery.
Yeah. So one thing is you catch something early, you treat it early. It's just think of it in terms of size. If you catch something early, the size is small. When it grows, it gets big. Removing a small thing is very easy. Removing a big thing which is stuck everywhere is extremely tough, and maybe a surgeon can't remove everything that it's stuck to, and that's when we start needing the help of chemo and radiation.
Absolutely.
So if you catch it small, then you don't even need all these extra adjuvant treatments, what we say. You can literally fix it in surgery. And then people get scared of surgery as the treatment, but then ultimately it's like if you can avoid chemo and radiation and being in the hospital for months at end, I think surgery is an easier option.
Absolutely. I always say surgical problems are any day far better than the medical chronic problems.
Yeah, definitely.
So you have a quick fix, you can, get done with it. And if you're in a safe surgeon's hand, your life is just as beautiful as ever, you don't have to freak out at all.
Yeah, our breast patients who come in and have something literally come in the day before, next day is the surgery, a day, maybe two if they feel comfortable in hospital and want to stay. By 1 week, they're totally out of it. By 1 month, they don't even remember that, okay, this whole issue happens.
Oh my God, I have to tell you about this, Lahari. I mean, of course, I operate day in and day out on a lot of women starting from the age of, very young on like 20s till 60s, 70s. But mind you, even my older patients, like who are undergoing hysterectomies today, are recovering so fast.
Yeah.
The total laparoscopic hysterectomies have become so easy and the recovery is so fast. Let me tell you, some of my patients are still working women. They're models. They're getting back to their modeling assignments in a week's time.
Yeah.
I have patients who are dancers who are going back to their dance assignments.
Yeah.
It's fabulous to see the recovery post-surgery nowadays.
It's really nothing to be that scared about. Knowing that you're a specialist in infertility. So are all infertility specialists also have a practice in obstetrics, or are there people only doing one or the other?
Usually, the majority of the ART specialists choose ART for the comfort of ART.
Okay.
So it's a cold branch in terms of there is no emergencies.
Okay.
You can choose to work 9 to 5.
Yeah.
It can be office job. You don't have to, you need not have to work on the weekends. You can plan a structured work-life balance.
Which is not how
That
your life
is that is perfect about ART. You can choose a very nice, comfortable life with ART. So most of the ART specialists, once they've specialized onto this, would not like to do obstetrics because obstetrics again is a different ball game. It's very demanding. It needs your 24/7 attention, presence, mental, physical, both. Right? So a lot of ART specialists don't practice obstetrics. What they normally do is they see you till about 12th week of your pregnancy. They take care of your early pregnancy and then they send you across to an obstetrician who looks after your pregnancy for the rest of the time and deliver you. But I'm one of those doctors who has been passionate about obstetrics and gynecology from day one. That's why I chose this branch. Then fertility came across as an add-on, It was more of a necessity for me because every other patient I was seeing in the OPD was a fertility patient. So I was just, getting hassled by that thought, oh my God, if I don't know this, I will not be able to serve the number of patients that I actually want to. And that is how I got into the fertility practice. Otherwise, I was very happy with my obstetrics and gynecology. And I thought infertility is not my forte because it was slightly a cold branch. I was a very surgical person by nature. I wanted to be more a hands-on surgeon. And this is a cold physician's branch. It's a medical branch. But then I try to balance both. So that's why I've been at both of them. And in fact, now after 10 years of practicing both of them with a good balance, I've understood that I'm able to do better ART by handling these pregnancies also because I know the whole story.
Yes.
Because I see my own friends who practice only ART who have the take-home baby rates less than me. That the only difference is not that they are anyways, inferior to me as ART specialists, but they're not able to take care of these pregnancies all throughout.
What is the take-home baby rate?
Roughly, the take-home baby rate is about 25 to 30%.
What does that mean?
That means the babies that actually deliver after full 9 months a healthy live birth.
Oh.
Because not every conception that happens with IVF turns into a live birth. Yes, there is a 30% miscarriage rates. There may be implantation failures. There may be other abnormalities. Like I said, there may be preterms, PROMs, so many other things. So the take-home baby rate is about 25%.
Yeah, I mean, definitely from where I am, if I had issues, I would want like one doctor to take care from the beginning all the way through.
Yes.
Yes, as a comfort.
Yes, I see that with a lot of patients, and specifically when the patient comes for the first consultation, they ask me this question.
Okay.
Doctor, will you be with me all throughout? Will you take care of me till the birth of my baby?
So me being married, as you know, and as probably all of you guys know at this point, you get this tendency to kind of, I want to dive one step deeper to like have the people listening be able to relate to the kind of choices we have to make. Not just as doctors, but working women and mothers and all. So being married, I started like really depending on my husband just as a companion to be able to be like, okay, if I've got a doctor visit, I kind of want him to come along. When is he free? So I feel like after a certain point, I started realizing that like my health journey is totally separate from his health journey. And that's something that I feel like a lot of my friends also struggle with. We get so caught up with the mothering and the wifing and working and all of it. It's like, you know, what is essential for us is one, to be alive and to be healthy, to fight another day. So the most important thing is to kind of, I feel, segregate yourself from everyone around you, including your child, including everyone, and say, like, I want to go to this person, or I want to get my checkup done. So that is the right. I feel the fundamental part of that is knowing your doctors well, right? Like, I can come to you when I want because there's a friendship. And like, until, and not everybody's blessed to, obviously, because we're doctors and we also happen to be from the same place, but
Yes.
you know, like, because we're doctors or whatever, we can form that friendship. Do you feel that having patients with who don't have that medical background access can still be friends with their doctors?
Absolutely. You know, with socials today, I think you have an exposure to every person even before you actually go and meet them firsthand.
Yeah.
Right? So you can do your recce on your, internet. You have every information about the credentials of the doctor, the place of the practice, what are their interests, what are their work ethics, and what is their approach to a condition. You know, most of this information is available on the internet today. So choose your doctor, whomever you are comfortable with, because not every person is comfortable with the same kind of an attitude that I might have. You know, I may have a different approach to a solution, but another doctor may have a different approach, and each patient is also different like that. Some like my way of approach, some may like another way of approach, which is totally fine. Some people prefer to talk out, some people don't want to talk, some people want to have it very private, which is also okay. So you will have to choose what kind of a person that you want to interact with. And once you have a frequency match, half the problem is solved. You don't have to worry much. Now, the second or third visit, more or less, the doctor knows what exactly is your, problem, how it has to be tackled, what are the best ways to kind of help you out through the situation, and there is a comfort level. That's what happens even in the antenatal checkup. The first visit, you warm up. By the second or third time, we are like talking to them as friends. And they are talking to us like family, And we always have these pictures at the end of the pregnancy journey where, we are hugging each other, we are smiling, there are tears rolling down the family's eyes. We have a fabulous celebration at the end of those 9 months. So this is the bonding that we gynecologists have with the patients. And fortunately, we are not just their gynecs, but we almost become their family doctors. Literally, the kind of bonding that we develop with them over those months, or each one has one or two pregnancies and probably one or two small gynec issues. They are with us for a significant amount of their time, and they have a fabulous, beautiful relationship with all of us. And even if they get a heart problem in the family, we are the first ones to be seeked out. They ask us, who's the best doctor that that we need to go and see. This is the kind of relationships that we always develop with our patients. And I think it's important for the patients also to, kind of come up with that kind of a comfort, have the ease to converse, tell them openly what they're looking out for. If they want a change like I have so many of my patients who come and tell me clearly that, doctor, please don't give me medicines. I will work only on my lifestyle. I will only work on my nutrition. And I'm okay with that approach. I'm very open. I don't want to thrust them down the medicines or thrust them down the surgical route just because, it is what the book says. We can always have that leverage of working out what their preferences are, what is the style of approach that we need to have with that individual patient. That flexibility should always be there.
Yeah, we don't actually, like in Bangalore Hospitals, we don't actually tell our doctors much because when we pick them, they're usually like people who vibe on the same level. But some of the things that I do request is like, just because, like, for example, I'm plastics, but every woman or man that walks into my doors, they get told on the entire spectrum of prevention. See, like, I feel in India, the person coming in and is enough. It's like, they're not really going to go to 100 different doctors. At this point, you may be the only doctor they see for the next 6 months or 1 year. So it's our responsibility to talk about cardiac health, to talk about cancer prevention, to talk about women's health or men's health, and just, give them that option. But nowadays, do you get a lot of patients where you feel like they think we're over telling some stuff? For example, like I had a patient who I had operated on, and usually for all my cosmetics wear, I get a treadmill test, ECG, echo, like non-negotiable, because cosmetics is like these people are same with obs, right? They're totally normal people walking in.
Yes.
And you're subjecting them to a surgical stress.
Yes.
So we are not going to take any chance for their health, right? And ultimately, patient puts, especially for surgeon side, like patient puts themselves in your hands. You're not taking a risk. So, but I get like some people who say like, oh, is that really necessary?
Yes.
Do you get that?
We do get, especially, especially when I ask for an ultrasound examination, Not everybody, this is not that common.
Yeah.
In fact, like I told you, I'm seeing a lot of changing trend where women are proactive.
Yeah.
They want to do more tests. They want to know
the
more.
dad or the husband.
Yeah,
Somebody asks.
they want to do more. In fact, pregnancy, I'm the one who actually tells them to tone down on the number of tests. There was a patient who actually ran from the office saying that one of our other friends in another hospital had a NIPT test. And why was I not asked to do a NIPT test? I said, NIPT is not for everybody.
Yeah.
We just need to do it only when necessary.
Yeah.
So I actually face the other problem, probably because I'm not someone who actually does a lot of tests or gives a long length of prescriptions. So, they're often asking me, doctor, should I do any other extra scan? Should I do any other extra blood test? But generally, I try to create a balance of, I do my preliminary work. My first visit is very important for me. I do most of my intensive work on my first visit, wherein I understand the whole story, whole picture. And then, the later on part, I kind of have a hold of the condition. I know where they're heading.
Yeah.
I kind of do my most important assessment in the first go.
Yeah.
And then later on, I'm quite easy on with them. I don't really push them for too many things. And they're comfortable with that idea.
So when somebody says, is this like medically necessary? And they're a patient and they really have no basis on which they're saying, how do you tackle that?
I tell them the value of that test.
Yeah.
Because they need to understand why we are doing that particular test to differentiate between X, Y, Z.
Yeah.
Because if I'm doing a surgery, now suppose there is a patient with a fibroid uterus and I'm planning a myomectomy.
Yeah.
Right? I have to go very well prepared into the OT to know exactly what is the number of fibroids, what is the location of the fibroids.
Yeah.
So that is where we need a MRI. We might have an ultrasound very well done just a month ago. But do I need a MRI again? Yes, I might need when there are multiple fibroids.
Yeah.
When there is a single fibroid, I'm okay with that damn scan, 1 month old, I don't need anything extra.
Right.
But if there is multiple fibroids, especially very close to the uterus, I know I'm going to go close to the endometrium. I might work on the ovaries a little bit.
Yeah.
I will definitely want extra tests.
So
Now we have a fibroid in the broad ligament.
Yeah.
I want to do a renal workup. I will keep everything prepared for a stenting. I will keep a backup urologist.
Yeah.
I will go very well prepared into the OT.
Yeah.
I can't just take it too casually.
So we've got an era of patients who are doubting doctors because of hospitals. Maybe their doubt is on the hospital systems and it's being translated onto doctors, where most patients are not 100% convinced that doctor is doing it for the patient.
That, of course, will be there, and that is there. That is where, your honest work over a period of time will add value to your, suggestions. Because now most of the patients who walk into the clinic are word of mouth, right? They already have seen our work. They've seen our work ethic.
Yes.
They know why we are asking for a certain thing. They will understand most of it. But if they have any extra doubts regarding any extra expenditure that is happening on any particular test, we should be prepared with a valid answer to tell them this is the benefit of doing this extra thing. for your own health.
Yeah, so
So
patients
once
should also
they
feel
are
free.
yes,
Yeah.
once they're convinced that it's a value added test with the value added information for the whole procedure and the outcome,
Yeah.
they're okay with it.
It's either, for me, two different types of patients. Either ones who are like okay to everything, or the people who make their own choices and don't want to do anything. So the better thing is to just be communicating constantly. Asking why is not some like not so offensive to the doctor, but you need to know what the reasons are.
I'm a big believer of barrier contraception, what is called as condom, but it's not just for contraception. It has fabulous health benefits like preventing STDs, preventing even simplest of chlamydial infections which go on to cause PID. I see so many women in 40s who are having chronic PID, and they're all monogamous women into stable marriages, married early on, have had 1 or 2 children, no comorbidities, everything very good with their health. They don't have any other health issues other than PID. And I know it's clearly stemming from the semen or the sexual activity which is harboring various bacteria. And women go through this cyclical low high phases of immunity. So during their menstrual cycle, their immunity is rock bottom. During their pregnancy, postpartum, it's rock bottom. One of those sexual random activities during this phase, unprotected, can harbor a lot of unwanted infections which may flare up later on. And this is what is the reason for PID. Like even infertility patients, whenever we are doing a diagnostic hysterolaparoscopies for infertility cases, I see PID in a lot of patients. So this has been a chronic issue with a lot of women, mind you, more than what is actually
And
discussed.
these are like married, like
Absolutely.
normal.
With safe
kind of-
sexual practices. That is
Yeah.
what I want to emphasize. So you
What is
can't
safe
even
sexual practice?
safe sexual practices is monogamous relationships, don't have any other bad habits. They don't have any smoking, alcohol or drug abuse. They have good immunity. They are on good nutrition. They are exercising well. This community of patients also we are seeing pelvic inflammation. We are seeing an increasing trend in ectopic pregnancies. Why is it happening? It's because of the secondary PIDs.
But why? Like
Why is, yeah, this is the reason, men, the semen is having a lot of organisms.
Okay.
You say it, you see it, you don't see it, it is there.
Okay.
And men have a long track, they have a better immunity, their immunity is stable throughout. They don't really see infections. You don't see UTIs in men as often.
Yeah.
Because the urinary tract is long, it kind of, protects you against those infections reaching your bladder.
Yeah.
But that's not the case with women. We have a shorter track. Like I said, we have cyclical changes in our immunity itself. We are prone to catch infections much faster than men.
And you say that the best prevention for all of this is condoms.
Condoms, yes.
Okay.
Because I have seen, I treat a lot of patients with pelvic infections. I would have treated them with multiple antibiotics, multiple things. I would have given them the HPV vaccine. I've given them probiotics for ends on 6 months. And still they come back with infections the moment they have an intercourse. They don't have a logical explanation. Neither do I have a very logical explanation. But I know it is stemming from the seminal fluid, right?
Yeah.
And the moment I start telling them, use a barrier, they tell me, doctor, I'm 45. Why should I use a barrier now? It is uncomfortable and not talked about. People are silent sufferers. There are a lot of women battling PID without even being aware of it. So, when they come to us actually is when it becomes really severe.
Yeah.
And when, it is causing severe pain, fever, chronic discharge, constantly draining them out, this is when they come. The early PIDs are all neglected.
Yeah. And what about sex before marriage? Like that, obviously, condoms, they say, is more for a prevention purpose. But in the same way, condoms, if you're having sex before marriage.
Sex before marriage, I think 100% condom usage is important because for both the people to prevent STDs, you don't know with the kind of promiscuity we have now, with the kind of social media and, the kind of social life people, there is a lot of change in the society norms, sexual norms in today's age.
Yeah.
People are into multiple partners. People don't know what is the background of the partners. They end up with a weekend sex.
Yeah.
So, you are exposed to anything rampant.
So
And you
multiple
have to be
partners-
careful.
yeah. Multiple partners, the issue is more infections, or is
It
that
is.
what yeah.
It is very much. I mean, there is psychosocial problems because of this, but I'm talking about the physical problems. Yes, they're constantly. I have women coming every Monday, leaving their work, worried about the weekend sex they've had.
Oh,
Yes,
yeah.
because most of these parties happen. They are in a intoxicated state. They don't know what has happened to them. They don't know who has done to them. These are the women that we see sometimes, and they're waiting for a Monday morning to see their gynec. They can't spend their Sunday peacefully because they're worried what has happened on a Friday night.
And you were telling me that like these morning after pills are an absolute no?
Absolutely no. See, I call it an emergency contraceptive.
Yeah.
It has to be used only in emergency situations.
Yeah.
A regularly sexually active woman, why will you even pop an eye pill? A married woman who's having intercourse, frequently in a month, why would you pop an eye pill?
But what
You remember, Lahari, we saw a patient who has popped an eye pill,
Yeah.
landed up in ectopic
Yeah.
pregnancy, who actually was in a very
Yeah.
bad state when she came in.
Yeah.
Is it even worth taking that risk? Not at all. Like,
eye pill causes that kind of scene.
absolutely. So you take the eye pill in the luteal phase or just after the ovulation.
Yeah.
You can slow down. It's a very high dose progesterone. So you can slow down the tubal motility completely. So there may be an embryo formation in the tube which cannot move back to the uterus.
Oh my
So obviously it gets stuck in your tube and causes the ectopic pregnancy.
Yeah.
How dangerous it is.
Yeah.
And it could have just been prevented. Even if you got pregnant, there are fabulous medicines now, medical termination, which can be, which can get rid of the pregnancy.
How early can you do that?
You can do it up to 7 weeks of pregnancy. So even after you know that you're pregnant, you have a good 2 or 3 weeks time to come into your clinic and take your medical pills for clearing the pregnancy. You don't have to panic and take 3 or 4 eye pills in a month every time you have an intercourse. That is what is causing a problem.
And you say that's worst.
It is extremely worse because one, it messes up with your cycles completely. People start having periods within the next 2-3 days. They don't know what's happened to their cycle. They start having chronic pain. They start having hormonal imbalances, headaches, lot of stress, sleep disturbances. We've seen a lot of problems with eye pills. So I would strictly advise everybody not to get into this at all.
Yeah.
Yeah.
So with people having, sex regularly before marriage with multiple partners, what is the maybe top 2-3 things that they can do to stay safe?
One is, of course, please don't venture into risky sexual practices. It's not worth your time, energy, or peace of mind, right?
Yeah.
You have to be very careful. It's like, today's generation is so particular about everything. They are a health proactive community. You see a lot of fitness clubs. I heard fitness clubs are the next dating clubs. People have stopped going to pubs and bars. They're meeting up in, yoga bars and Pilates sessions. You can always have an open discussion. And if somebody is getting offended with your choices of your sexual choices or, sexual preferences or intimacy options, I think, it's a big no-no to the relationship. They have to have an open mind, open discussion, understand the partner, what is their comfort level, and of course, protected intercourse is the norm.
Yeah, in medical school, they used to teach us the psychosocial and economic impact of health. We call them the social determinants of health. So it's so crazy, when we're reading about it in school, we kind of roll our eyes and we don't really pay attention because we feel that's not the interesting stuff. But then when you come into practice, then you start seeing that is everything, actually. And being very firm on those intangibles in a person's life and kind of being a guiding force that way as a doctor is very, very important.
Totally.
Yeah. Do you feel that patients respond well to that? Because I know in US, things are different. You can't exactly say black and white things. Everything has to be in the gray, and it's up to you. It's up to the patient, but these are the facts, right? So whereas in India, we come from a much more relationship-based doctoring where ultimately something happens to your patient. It's like something has happened to you. Some extension, some responsibility gets assigned on me. not the hospital, not on anybody else, but somewhere the responsibility lies on me.
Yes, you are personally attached beyond a point, especially when you're seeing the patient on and on over a period of time, in spite or despite whether it's right or wrong. There is an emotional involvement in a doctor-patient relationship. You can't be detached. Especially when it comes to pain, sorrow, they would have, lived their best and the worst moments with you. Right? So it's your duty as a care provider to kind of tell them what is the right and wrong. And also give them neutral opinions about how they have to approach a certain situation in their family. Because like I said, I see a lot of young women who are totally clueless. And the moment I educate them, they are like, yes, good doctor, I didn't know about it. Good, I spoke to you about this today.
100%.
Good, I'm going to, be more careful. We have a very receptive audience and they're willing to know more. They're willing to understand the science behind what we are speaking. That's the best part of today's generation with the internet information. They're already informed, but they want clarity on issues, which is what we are providing.
Exactly. And I even suggest, like, if you want to know more and I see them, I just say, like, you ask me, I'll give you papers, evidence-based guidelines and research on why we are saying what we say. Most doctors don't actually in India, maybe, I don't know about all, but at least we don't put our personal opinions behind this. It's all evidence-based and research-based decisions that have come, and that's why we are telling certain things. So most of the times if you disagree or you have a doubt, definitely ask why. And I think that's why I keep reiterating it's very important how you choose your doctor, because that's step A. Step 1 is deciding to choose a doctor. Step 2 is who you choose. And that makes all the difference all the way down the line. Phani ma'am is also married to a very, very busy orthopedic surgeon. And how is that like? I mean, you are the only other person I know whose husband, like, rivals being as busy. I still think you're busier, but...
No, that's a difficult question to answer. But yes, two surgeons under one roof is what I call this syndrome. And two surgeons under one roof is sometimes very difficult, sometimes very tricky, unless you have a friend in your partner. And luckily for me, my husband, Dr. Sunil Kini, is a fabulous husband, but is even more a fabulous friend. He's been my best friend. I mean, we courted for quite some time and then we decided to get married. And that's been the best decision so far, voluntarily, my conscious mind has ever made, because, I feel that has been so instrumental in the way my career has, grown, or what kind of a doctor I've eventually become as of today, 20 years down the line since I've met Sunil. I have grown as a person, I've grown as a doctor, I've matured as a doctor, and the kind of passion that I have for my work is... He totally understands it, and so do I. We've always been encouraging of each other's work. We are never like, you had to do this and I had to fill in for you. We know that if you're not here physically present, you're there somewhere else doing something more important. So that's been the mindset with which we've handled the marriage also. And that's what has helped, because when you have a child, again, there are so many responsibilities that both of you have to balance. And it's not easy because, some days he may be there, some days I may be there. And you can't just keep on competing that you didn't do this or I didn't do this. It's about we have to do this. So that has always been our, motto towards the family or towards the child and towards us also. So we have that every Saturday evening just to ourselves. We wind up the clinic very, very late, like, we wind it up at 9 o'clock, but 9 to 10 is our time. We definitely sit down and have a chat, understand what's happened over the week, and then, the Sunday is for the family and child and, the family activities. But you need to proactively work on the relationships also.
So are there any jobs at home when it comes to the kid that you say, like, that you guys think, okay, this is only dad's job or this is only mom's job?
Well, I mean, of course, each one has their pluses and minuses. Sunil is great with all the techno stuff and, the internet or, doing his sports, games. He is very proactive with giving him that playtime. And I'm more with, the food or, the entertainment, socializing with other moms, taking him for play dates. We have our pluses and minuses. So we segregate work accordingly because even he needs to rest. Sunil has a very hectic life.
Yeah.
So, I can't, drag him out for every child outing
Yeah.
that I need to be. Just because I have to go out with my son to some birthday party, I can't tell that, you have to be physically present.
Yeah.
So I give him that free time. He relaxes at home, probably. He has his time with his own friends and, he can regenerate. So that's how we've been balancing all these
I'm
years.
recently starting this new kind of thought process where I'm like, oh, I just realized that he's also busy and he's also working. So I think I'm now thinking like, okay, let him do the work, because I feel like the problem with both of us being in the same career, in the same mind space all the time, in the same activities, we kind of just end up being locked, especially if you do enjoy each other's company. But then sometimes it's not that we've reached the point where it's too much. We like hanging out with each other, but then at some point you start thinking that everything has to be done together. And I started like kind of putting my priorities on the backbone, or back burner, working out or going to doctor's appointments, or you start just thinking, oh, it'll be more fun if your partner comes with you, or taking my daughter here and there. So I think like one of the things that I've started to do is take my own time.
Absolutely.
And like let him be very purposeful, as you said, about giving him his time. So that's also one of the things that I started to do recently.
Very important for all women.
Yeah.
Luckily, I am like that by nature.
Yeah.
And I've always been hyper independent. I don't need company per se for every activity in my life.
Yeah.
I love people. I love conversing. I need, those beautiful, enriching conversations. But I can, be very happy with my own company.
Yeah.
This is what I think women have to inculcate.
Exactly.
And, that is what is going to be the next most feministic activity that they can do for themselves.
I that's why through the podcast you'll hear me try to get back to this. It's that I think the solution for us is to separate from everybody and understand that there are certain things that only we can do for ourselves and nobody's going to do it for us. For example, heading to the doctor every 6 months once to just figure out what's going on with you. That's maybe an hour, 2 hours of your time. At any time that you want to do it. It's not like you have to go on the 15th of this month. So any time that you want to do it, but you're doing it for you. And in the same way, okay, daily you give off to everybody, but at least start with the health. I think
totally agree with you, Lahari.
Yeah.
I in fact tell all my patients that, the fertility journey, like a lot of patients come to me for fertility issues. It's not a day's job. It's not that you're walking in with a tumor and, I post you for a surgery and you're going back at a certain date home. Fertility journey can sometimes last from a couple of months to a couple of years.
Yeah.
And it can be longer also, just in case, we are not lucky.
Yeah.
So you can't, constantly be pressurized about the thought, my husband is not with me with every visit. Does this mean that he is not loving me enough? So these are not the self-doubt questions that you need to ask. You have to segregate your work. You need to do things as a unit. And each one has to be supportive of others, space and time and a professional motive.
Yeah.
This is very important.
And what time does your day actually start on a regular weekday?
On a regular weekday, I usually start my work at 9. Like, obstetricians don't have a set timing, but I try to modulate most of my days.
Wake up?
I wake up at
I
6.
know this about you, so
Yes.
I was going to know how crazy you are.
I am a very me, myself kind of a person.
Yeah.
I don't, compromise my sleep.
So you're up.
I'm usually up by 6 o'clock and my day begins with kind of, sorting out the food for the day because it's very important. I soon understood that nutrition, if sorted out, most of the other things are sorted out. So my priority is to at least get my breakfast and lunch done for the family because the dinners are usually made towards the end of the day. Like, we have someone coming in and doing the dinners in the evening. So that's sorted out.
Okay.
But my main, the big part of my day is like my breakfast and lunch has to be sorted out.
And
so I sort out. I don't cook now,
Yeah.
but I have help. But I'm
Okay.
proactive in the kitchen.
Okay.
I kind of, oversee what is happening in the
Yeah.
kitchen, what amount of oil is going in,
Yeah.
what is getting made. Yes, I'm very constantly involved in this process. And so once the food is sorted, I pack my son's box. He gets ready for the school. I drop him most of the time to the school because that's the bonding time, because these are memories for his life. I might be the best doctor outside, but if I'm not a connected mother, I might lose out on this game, very soon.
Yeah.
And the children grow up so very fast, and childhood memories are the core memories that they have for the rest of their life. So I need some time to bond with him, and the food is the main connect. So that's the reason I'm very proactively involved in the kitchen. There are certain things that he loves what I make, and that's the connect between the
Yeah.
child and the
That
mother.
makes you feel
At the end of the
useful too.
day, yes,
Yeah.
yes, I understood this very early on, that food is a very strong connect. So I devote some time to
Work that by 9.
yeah. So and then 8 o'clock I drop off Sohan to his school, and 8 to 9 is my time, my workout time.
Okay.
Yeah, no matter what, like there are certain days where there is some work call that comes up. I might have an emergency delivery or something else that I would have posted for the morning hours. So I might miss out on a couple of days, but I try to work out at least 4 to 5 times in a week, and 8 to 9 is my workout time.
Okay.
And then 9:30, 10ish, I get out of the house.
Yeah.
And then I start my day. I run 4 clinics, so
Yeah.
it's a little hectic for me. I go to 4 geographical areas literally and practice. So, but I'm very happy. I'm passionate about the work I do. I don't feel the burden of the work in terms of the long hours. But some days it's exhausting because I have to coordinate a lot of things, like
Yeah.
a delivery case, a fertility case. I might have a laparoscopic surgery, which is very complex.
New people in OPD.
Yes, the most draining
That's
part is
the
the
most,
OPD.
yeah.
Yes, for all the doctors,
Yeah.
because for you it may be your that first day, first problem, but I have to talk to you with the same amount of enthusiasm and passion that yes, it's my first time too.
Yeah.
Which is not the reality. Unfortunately, we have been doing this monotonously over years, and beyond a point, yeah, monotony hits you. But that's the whole point, right? This job demands that kind of enthusiasm and prioritization.
So
Which is what I have
yeah.
started mastering,
I started asking patients to come to OT recovery.
Yeah.
So that they don't have to wait. And for me, it's like, okay, hello, and do it. And
Yes.
then they go for the test. By then, you're down. And
Yes.
my philosophy is, at any cost, some solution has to be given to the patient in that same sitting.
Absolutely.
Even if I don't charge or anything, but I will even call them and tell them.
Yes.
Like, let's say I couldn't get them the information at the hospital. By evening, I'll call and say, look, this is what we're doing. This is what we're working on. And, this is the solution that we're looking at.
Absolutely.
Yeah, that is so, you can't, I feel like crazy to kind of leave a patient waiting, thinking about their health overnight.
Yes.
At least
very,
any
very
word from
difficult.
doctor that we're thinking with.
So I do a lot of my work on WhatsApp.
Yeah.
And that's the reason, it's really benefited me. Most of the report sending, communication about the reports,
Yeah.
and if it's some simple advices, pregnancy, especially ART pregnancies have so many ups and downs. We do a lot of work on the WhatsApp.
Yeah.
There's a constant communication, open
Yeah.
communication there. So we know which are the patients that we need to keep in mind, who are the high-risk patients.
Yeah.
So we have a tab of them, and we are constantly, updated about what is happening with them.
Yeah.
And of course, the cold cases, we know that, these patients are cold enough to be left alone for some time.
Yeah.
So prioritization is again very important.
Yes.
You know where you have to focus, which patient you need to give more attention to. And my patients all are, very well in sync with my work life.
Yes.
They know what is happening. Suppose they don't see me somewhere, they come back to another clinic and see me. They have to see me, they will come and see me, or they communicate over the phone, WhatsApp. And there are my assistants round the clock helping them out,
Yeah.
who are as good. I mean, they're so professional now that they know exactly what needs to be done at what point.
Yeah.
And they're there round the clock helping them. And you have the registrars round the clock in the hospital. So the whole ecosystem is very important, Lahari. It's not a one man's job. At the end of the day, we are seeing the numbers which not many countries see. The kind of numbers that the Indian doctors see is magnanimous.
Yeah.
We are of course, putting in a lot of physical effort as compared to doctors elsewhere.
Yeah, we were talking about your friends. You recently went to a conference.
Yes, yes,
So her friends were telling that, like, why are you running around so much? You're doing too much work.
yes.
The response,
Obviously,
yeah.
yes. A lot of women, not just young, different age groups, were constantly worried about their external looks. There's a constant debate whether this is a question of vanity or, self-care, or it's important for your physical health. People are constantly unhappy with the way they look.
Yeah.
They're not happy either with the breast size, they're not happy with their abdomen, especially post-delivery. There's a lot of fad about the mommy makeover.
Yeah.
So what is your opinion about this?
So I think it's like very indicative of our society. In the beginning, it was all about, telling women they should look a certain way. And so all the media, men, and everybody has kind of made women feel like this is the ideal of what a woman should look like. And that has been cemented maybe 50 years ago, 100 years ago. And now, until then, it's not that the idea was not there for women that they should take control of their looks, or they can, augment certain things or take away certain things. But they kind of stayed at home and brooded internally that I am not good looking. I am not good looking. I don't match with this, so I am not good looking.
Right.
And probably for a few decades ahead of our time now, like our mother's generation, they are aware. If you talk to your, the way I like to describe it is, if you talk to your grandmother, she knows what's the ideal standard of beauty, but she doesn't know. She's not so articulate on how she compares to that ideal, because for them, the movie actors like Savitri and all these movie actors, then they were they're likened to the goddesses. Even the movies at that time, most of them were, they
Mythological.
and mythological kind of creatures. So they never saw actresses as like something that's attainable. It became like our grandparents see very, very good-looking women as just that. They are good-looking. We are normal people. Then when you start talking to our mothers know what is the ideal body weight, body shape, how the women are aging. If you talk to your mom now, she knows which actresses are in her subset, her age group, and how they look compared to her. That comparison started. Why? Because they had access to Western culture, access to media, internet, and they saw that, okay, somehow, they don't know exactly how, but somehow these people my age are looking like this. And that lower self-esteem kind of started, where like they don't know exactly the mechanism, that it's all surgery. Like if I tell my mom now that I can make these like 2 lines go away for you, she's like, no, you can't. Like she doesn't even believe me that it's possible, because as they were growing up, they compared themselves, but only by bringing themselves down. They didn't realize that, okay,
It was achievable.
Attain this.
Yeah, it wasn't
Because
achievable.
It was totally mystified. There's nobody on social media saying, like Kylie Jenner, this implant, this size, this volume, and this doctor. Nobody was giving that kind of direction to them. And so they thought that they naturally were ending up pretty, or if they put that sunipindi or they put the lemon, that's how the actresses have turned up. Actresses also at that time were ashamed to kind of come out with things, because the ideal from our grandmother's time is that these women are just this beautiful,
Born
period.
like this.
Born like this. And so their actresses they're also humans. They're not some goddess coming from somewhere else. No, they're also just like you and me. They're working a job. They need to show that, no, I deserve this job because I look like this. I was born like this. This is my birthright and this is my luck. Because if you think about it, in media also, models were not supposed to have personality. They were only supposed to go off of their looks. Actresses are only supposed to go off of their looks. They should not talk even beyond what the hero is talking. Now, the idea that the actresses and models themselves have something to offer to society and to production other than their looks is only starting today.
Right.
So for our parents and our mothers and aunts, they they knew that they were beautiful, but how they're beautiful, they don't know. But definitely that there's an expectation of our mother to be equally as beautiful is there. So I feel like that self-esteem now trickled down to their daughters, who is us, right? Like that, okay, see, she looks like this. Because they couldn't do it. So now they're telling their daughters, like, you should look like this. You should do this. You should do that. And then as time went on and we became older, at the same time, actresses have other things that people are interested on. Like nobody is, of course, like if you take the Kardashians, they're beautiful. But they're not only beautiful. Beauty only takes them so far. In fact, they're not conventionally beautiful, right? They're popular because they're unconventionally beautiful and they're honest about their beauty.
Right.
And that's what started the wave, is like we started realizing in our age group that even though we had the special complex / advantage of knowing, like, I want a nose like that. My nose has a hump. I don't want that hump. Or I have love handles. I really don't want the love handles. Or my breast, one is big, one is small. I want that corrected. And then because of media and access and transparency, we now have the ability to say, like, even if I ask, anybody, even, my housekeeping staff in hospital, that this lady has one breast small and one breast big, is there a way to fix it? She'll say, yeah, doctor can do that, right? That's how much the idea of changing your appearance, not to achieve an ideal, but to achieve what you want, has become.
Right.
So now people think like, and before in the 90s, my dad is also a cosmetic surgeon, and he used to tell us stories, and I used to work in his office. Women used to come in and say, like, with pictures, I want to look like this. Like Angelina Jolie's picture, I want to look like this. Or Penelope Cruz, I want to look like this. Now nobody walks in with a picture of others anymore.
They just want themselves to be better.
They want themselves to be better. So we've gone a long way from people thinking that some women in our grandparents' age are just blessed and they're goddesses and they're born like that, to then our mothers saying that, oh my God, I don't look like this. Why does this woman look like this? To being like, I don't want to look like anybody else. I myself want to be that want to be an actress.
Right.
I want to be a social media star, whatever. So that's like, it's all evolving. Yeah, it's evolving, and we're in the right time and right place. Because not just in plastic surgery, but in the feminist movement also, like, we have the opportunity to say that I want something and get it done.
Absolutely.
And
achievable.
It's achievable, and science is backing that. Science and doctors and people who believe in women being able to be the best version of themselves.
So how do you decide, how much the patient can change herself?
Yeah.
Cosmetically.
So when, basic thing is, when a person comes in and they want it, you must assume that they have wanted it and thought about it for a while. I feel like many doctors, when most of the inhibition is that patients are scared that the doctor will say, like, you don't need. There are times when you say you don't need, but the baseline is that, you don't discount their want, because they have been thinking about it probably for, a year. Baseline, I take 6 months. This thought has been in this person's head. Right. So the first thing I ask is, like, so what are you looking for today? Right? What do you want? Explain it to me. Because in beauty, no one is more of an expert than the person themselves.
Absolutely.
Yeah.
So I agree with it.
Yeah, like, because if it's more medical issues, or for example,
you can opine.
Yeah, then I'm the expert.
Yes.
Like how the surgery should be done, how many days they should stop smoking, how many days they should not take these medicines. That I'm the expert, I'll tell you. But what you want to look like, I can't tell.
Absolutely. Yeah. It's their choice.
Yeah, it's absolutely their choice. I may see somebody's nose and I may think that the tip is coming down, or there's a bump on the top. But for them, they only care about the bump. They love that the tip is down.
Absolutely.
They don't even see it as a concern.
Right.
So you need to, at least from my side, what I do is I sit with them for 1 hour. Like, if my entire team knows that if I have a cosmetics patient, the office shuts down for an hour.
Right.
Privacy also.
I know.
Absolute privacy and absolute transparency. What do you want? And then after that, I tell them.
Right.
To get this, I would have to do this.
Right.
To get this, I need to do this. Now you tell me, what out of these options, what works for you?
Correct.
So some people may say, for example, I take a nose that if you want to correct the bump, I can do it with filler. If you want to bring the tip from facing down to facing up, it's better done with surgery. Now, are you somebody who only wants injections, or are you okay with the surgery? So the other thing is like, so when you say like, how do you decide? Like, ultimately, I don't decide. They decide.
Ultimately, they decide. Yeah.
My job is to give them the options.
Right.
Like, these are all the non-invasive and invasive options. Now, I'm giving you what I think would work best for you in terms of technique. But the result, the outcome is on you, what you want.
Right.
The old teaching of plastic surgeons, they say that you should never do what the patient wants you to do. Like all our bosses and everything, this is how they teach us. Why? Because they're used to patients wanting totally something else,
Which may not be actually
good
for them.
Good for them, and they may turn out to look like a disaster, right?
Which has happened in a lot of instances.
100%. Most of the disasters that have
It's because
happened, patient-driven and doctor-driven. Like the what do you say? The intention of the doctor is not in the right place.
Right.
Like if the intention of my practice is to give natural results, it's not to do this number of cases or that or this or that. Ultimately, I don't really have to push that many patients
Totally.
to kind of survive. This is a passion of mine, and that's what I'm doing. So ultimately, my point is that they need to look natural. Tomorrow, when they go to a party,
Natural and more confident about themselves.
Yeah. And when they go to a party, nobody should ask who's your surgeon, right? Because they shouldn't know in the first place that something was done. So that, and that takes, like, my approach is like small changes over a very long time.
Perfect. Yeah. Well, I have a set of patients who actually come and tell me this. Doctor, will you offer me surrogacy because I don't want to carry a baby?
Yeah.
I don't want to distort my body. I don't want, scars on my tummy or, cut on my vagina. What will you tell these patients?
So there's multiple reasons for surrogacy, as you obviously are an
Yeah,
expert.
yeah.
But like, if cosmetics, if the way you look is the only reason why you choose surrogacy, of course, pregnancy, as somebody who's gone through it myself, it wreaks havoc on the body. But at the same time, there are ways to fix every part of that. And mommy makeovers, I don't do it all in one go, because I think it's important that you stay under anesthesia time for less amount of time in one sitting. And you have to kind of isolate what's most important to you. Of course, the breasts will sag. One breast will be in a different position, in a different shape only than the other breast. The tummy will sag. The vagina will loosen. And those are the main things. But then the
Eyes, the hips.
Yeah, the fat distribution changes. And then the other part is the facial changes. So the face becomes puffy. The eyelids become bigger. The nose becomes bulbous.
puffy.
Yeah. And all these things, you start losing hair, and all these changes happen. So it's like surrogacy, the choice is like, are you willing to go through the journey of pregnancy? If no, then surrogacy is a great option. Are you afraid that your body is going to be destroyed? It will be, but then there are solutions for it, and you can get back to your pre-pregnancy shape. Obviously, you also must have a protocol to keep the pregnant lady, like,
Absolutely.
and one of your biggest things is don't gain too much weight.
Absolutely. I tell them, we have moved from a generation where undernutrition was a problem. The ideal supplements or the ideal weight gain for a pregnant mother was all formulated in 200 years ago, when actually people were undernourished.
Yeah.
That's why you had to gain 15 kilos of weight.
Exactly.
But now we are in a generation of overnourishment.
Yeah.
People, by the time they come to us with their first pregnancy, they're already BMI 28, 30.
They're healthy.
Yeah, when their pre-existing BMI is higher, why would I ask them to gain weight during their pregnancy? they already have enough reserves to produce a good 3.5 kg baby without gaining any weight.
Yeah.
Which is so your pre-existing BMI and pre-existing nutrition is what will determine how much of weight gain that you have to go through in your pregnancy. The moment you're careful, you're active throughout your pregnancy, you've, had a fantastic, smooth, easy pregnancy, the recovery is absolutely fast.
Yeah.
I mean, I see women like 3-4 weeks post-delivery, you
Working
can't
out.
even make out that they delivered a
I was
child
not
3
one of
weeks
those
ago.
people, but yeah. So
Yeah, so I think it's all about how you take care, how you actually manage them throughout your pre-pregnancy and pregnancy and delivery, and of course the postpartum. The most neglected time is the postpartum.
I swear, yeah.
They're into so much of distress, lack of sleep, and so many other issues
Yeah.
that happen in the postpartum that they just give up.
Yeah, postpartum abdominal binder is number one. That I didn't do, and I'm still suffering from that. But that is the number one thing. The second is like a dense cream throughout your pregnancy for the stretch marks. And regular nutrition, good hydration, and you should be honestly fine if you have the right
And
doctors.
good workout.
Yeah, and working.
Very important to work out and get back to your routine as early as possible after postpartum. You don't have to rest for years on after postpartum to, think that you're ready or fit for the next. Never like that. It's just 2 months of recovery time that you need post-delivery, and you can up and be back at the gym, working out, get your muscles back.
Yeah.
And only the muscles are the ones which will help you.
Right.
Rest, how much ever fixation you do on the skin, if you don't have a good tone, I'm sure as a plastic surgeon you fail to deliver the kind of results they want.
So when it's mommy makeovers type of scene, for the abdominoplasty, first we retighten the muscles. And then we do the skin and fat cover.
Totally.
So first is we tighten up the muscles and give you a nice corset there. Without the muscle coming together and giving you the waistline, no matter what we do with the outside, it's not going to hold. So that's very important. And I think like if you are in a place where you think you don't want to get pregnant because you're afraid of your body, involve plastic surgeon in the beginning only, and we'll tell you, like what are the changes that'll happen, what we can do for it, and when we can do it. It's also stupidity as a public service announcement to do a plastic surgery in between baby 1 and baby 2.
Stupid. Very stupid.
Just don't.
I've had a patient who was like probably 35.
Yeah.
Already the ovarian reserve is decreasing. She's delivered her first child 5 years ago. She just had a routine checkup. Asymptomatic patient landed up with an umbilical hernia, small one. And the surgeon operated her.
Yeah.
Just because, they wanted to do it.
Yeah.
He just convinced her for a surgery, and now for the next 1 year, she can't plan.
Yeah.
She came back 3 months after the surgery asking me when she can plan this baby. I said, what was the point of doing a constructive procedure
That's why,
before you completed your family? You always have to finish your family, especially in asymptomatic patients, and then go about it.
That's why women doctors, for women patients, not to be sexist, but certain priorities will be in our head already.
Absolutely.
Yeah.
Absolutely.
We've been through it. So like obviously I thought I had a hernia because I'm a little paranoid that way, but I didn't. But when, for example, in this condition, if you fix a hernia with mesh, and then you've already given a gap, you fixed it down, so nothing's gonna move in that abdomen.
Correct.
And then you're asking the baby to grow when you fix the abdomen hard with an immovable structure. Where will the abdomen grow?
Where is the space?
Yeah.
I see a lot of these patients who have done tummy tuck, abdominoplasties, and their pregnancies look so restricted. At least the skin is like, dying to stretch.
Yeah.
Can't stretch. You have such a horrible looking tummy. It doesn't look like a real beautiful pregnancy tummy. And they're constantly worried, my tummy is not looking like the normal tummy. I said, yes, because of a procedure you've done.
And there's different ways of that, right? Like if you want to get your tummy fat taken care of before pregnancy, you should go for a liposuction instead of an abdominoplasty. Tummy tuck actually removes your skin. Liposuction just sucks the fat out. And fat can grow anytime again, and it doesn't restrict your stomach movement. On top of that, there's something called a mini tummy tuck, where you're not actually removing the entire abdomen, pulling it down. You're just trimming the fat on the bottom. So there's different solutions for different times in your life. So now let's get straight to the checklist. All in all, what is the schedule for a woman?
Yes, I think it's very important to start seeing your gynecologist early on in 20s at the age of 21, or if you're sexually active, please get your pap smear done and repeat them once every 3 years and keep a constant check on them. And then you can do your routine ultrasound examination probably once a year. This can pick up a lot of conditions like your PCOS, endometriosis, fibroids, polyps, etc., any infections. And also you can, have a regular checkup with your gynecologist regarding your nutrition, your diet, your exercise. These modules will really help you in maintaining your good health before your pregnancy. And then you can go about your planning your pregnancy and delivery.
Yeah, and monthly breast exams after 18. Yeah, every 6 months with the doctor. Once a year ultrasound of the breast as well, and I think you're sorted.
Yes, and you can get in for an X-ray mammogram after the age of 40, or if you have any other high-risk conditions or a family history of cancers, you can do it early on also.
Yeah, perfect. So now we just want to do a quick myth or fact. So I'll just put up a scenario and you say whether it's a. So you should change your sanitary pad every 8 hours.
Every 2 hours?
Every 2 hours?
No. You need not have to redo your pads so often. I think 4 to 6 hours is a good duration. And if you're feeling that you're over soaking a little early on is fine, but about 4 to 6 hours is good. But if you leave it on for a long time, you can have infections setting in the blood, and that can cause irritation, the skin irritation, infections, pelvic infections, etc.
Okay, and you can't get pregnant during your period?
It's quite rare, but still, if you have an unprotected intercourse during the fag end of your menstrual cycle and you have a early short cycle, like a 21-day cycle, you can still become pregnant because the sperms once ejaculated are alive for about 72 hours and the egg release will be alive for about 48 hours. So there are rare cases where there are pregnancies with unprotected intercourse during your menstruation also.
And skipping meals helps with weight loss?
Not at all. Girls, please don't skip your meals. Try to eat at least small portions every few hours. Women metabolism is very different from men. There are in fact a lot of women who can't get into intermittent fasting or water fasting or whatever fads that are, because women have different metabolism during different periods of their cycle. So you need to listen to your body and give it nutrition whenever needed. If you want to control your calories, the ideal way is to eat healthy, put the right kind of things in your mouth and small portions.
And you need 8 glasses of water every day.
Well, that's true to an extent, but I think the amount of water that you need is totally dependent on the situations that you live in, like your climatic conditions, the kind of activity you are into, and try to have as much water as your body needs to. First, listen to your body's thirst signals. So I think we've had a fabulous session today, Dr. Lahari, and if any of you all have any further questions regarding your health, regarding your pregnancy, fertility journey, or if you've had IVF failures, you've had any problems in your family or with your friends, you're open to put in those questions and comments in the comment section. We'll be more than happy to answer you anytime.
Thank you guys so much for listening to me and Dr. Phani on Doctors on Doctors by Bangalore Hospitals. Bangalore Hospitals really wants to show you how good doctors are and how they talk, how they move, and how their lives are like behind the scenes. So feel free to leave your questions and comments below, and we'll be so happy to respond. Thank you and see you next time.